Welcome to the Mile High Podcast. This is your host, Dr. Daniel Knowles. Thank you for joining us on this podcast. And I know all the people that listen to this enjoy it. They want to make sure they catch every bit of Mile High Ticks. So make sure to hit the subscribe button, whatever channel you are listening or watching this on, whether it be iTunes or Stitcher or YouTube, whatever it is, make sure you hit subscribe so you're always tuned into Mile High Tick. And of course, clear your calendar now. 2023 is when you want to rise up to Mile High Altitude is September 23rd of 2023. Right now, I'm really glad to introduce our guest today. He spoke at Mile High 2 years ago and also presented Mile High in one of our breakout sessions. Ian Shtulman is a second-generation chiropractor, and I always love speaking to second, third-generation chiropractors. A second-generation chiropractor, private practice in Palm Beach County, Florida. Soon after graduating LifeView, he got the Philosophy Distinction Award, which is so important, a diplomate in pediatrics, and he teaches for the ICPA, and he did incredible presentations Mile High the last couple of years. Just people raved about his presentations, and so I'm sure you're going to get a lot of value out of this particular podcast for your practice and serving your community. Thank you for joining us today, Dr. Ian.
Thank you, Danny. I really appreciate it.
Well, we're glad to have you here. And we're in the summer and going into, in August, there's going to be an incredible ICPA event, which I'm sure we'll talk about in a little bit. So this will be, it probably should be on your radar for about a month from now. So we'll talk about that a little bit. First of all, let's people get to know you personally, though. Can you share a little bit about your journey to becoming a chiropractor?
Sure. I'm a second-generation chiropractor, but I didn't really grow up in chiropractic. Now, what I mean by that is I grew up getting adjusted, but my dad had very much of like a natural orthopedic style practice. And he helped a lot of people, but he didn't really have the philosophy where I grew up thinking above, down, inside out about everything. Mm-hmm. And so, I was actually planning on becoming an orthopedic surgeon. I was doing all my pre-med stuff at University of Florida. And my dad had just gotten back from Total Solution. He bought an Insight subluxation station. He went out with Gentempo and Kent and did the Total Solution program. And he came back on fire for this chiropractic.
Wow.
And, it was the first time that I had ever seen that in my life. And he started talking about the nervous system and subluxation. He started talking about all of these things. And I didn't know where this came from. So he was driving me up to school and he put in a new patient, like a lay lecture that he had on a CD, back when cars came as CD players. And I'll never forget, the title was The Magic in You by Dr. Howard Shtulman. And I listened to him present a basic lay lecture, talking about what health really is, talking about the nervous system and how subluxation disrupts the nervous system and affects our adaptability, and how chiropractic helps to restore and facilitate health and well-being. And all of a sudden my mind was blown. And I said, that's what I want to do. Right? Like, how did I not know this? It was just like amazing. And so I changed my course right then and there. And since about my sophomore year in undergrad, I knew that I wanted to be a chiropractor. My dad brought me to some seminars and I got fired up and the rest is history.
Wow, that's so exciting. And I'll tell you, I know myself that when I went to Total Solution, I just graduated Sherman, and it really was a phenomenal program. CLA does an incredible job with that. So I'm not surprised that lit a spark for your dad. And then, then how did that become to where you get such a pediatric focus in your clinical area? Where did that become such a passion for you?
I was in my first quarter at Life University. And okay. They had like a quarterly seminar. I think it was called Life Source. They've gone through so many iterations of it over the past, however many years. But it was like a one-day event, and one of the speakers was Jeannie Ohm. And Jeannie had this way of communicating with such passion that it didn't matter if you liked children or had any interest in pregnancy. You listened to Jeannie talk and you immediately wanted to dedicate your life to serving that population. She spoke so clearly about how subluxation interferes with pregnancy and birth and postpartum transition for mom and baby, and the role that we as chiropractors can play in affecting not only the birth experience for mom and baby, but the imprinting of life upon that child from the very start, and making sure that they can experience and adapt and respond to the world in an unsubluxated manner from birth, and how important that is, not just for that child, but for humanity. And I remember leaving her little class, or her little 45-minute lecture, and I turned to a friend of mine and I said, that's what I'm going to do the rest of my life. And I did all the ICPA classes in school, and I graduated. I moved to South Florida, and it just so happened at the exact same time that I was opening up a practice, there was a midwife and a doula who were opening up the first freestanding birth center in Palm Beach County. And so I interviewed with them, and it was a combination of just like my raw energy and excitement of getting out of school, but that level of certainty that the chiropractic philosophy had given me, that just I knew subluxation interferes with normal function in pregnant and pediatric populations, and that chiropractic adjustments are not only valuable, but are necessary for these groups of people. And I wanted to do anything I can to make that possible. And they brought me in as a 25-year-old, fatherless or, childless kid, just brought me right in, and I became immediately the team chiropractor for the birth center. And it just kind of spiraled from there.
Wow. That's very exciting. And I know, the reason I first had you, as we were talking before we started recording, we had interviewed you in one of the Sherman Connect episodes way back in the day. Yeah. And I was looking for speakers for Mile High and looking for who were some of the most people that I heard the most positive feedback about. And so many people told me you. In fact, our associate Patrick Martin said he heard you speak at an assembly at Life West, and he said, "Wow, you got to have Dr. Ian. He's amazing." And I never heard you present, but people loved you speaking at Mile High. Before we get into some of the questions about communication, family wellness practice, let's just make sure that's on people's radar, which is the ICPA event that's coming up. When is that, and how people can learn more? And then let's dive into the communication for family wellness practice.
Yeah, so the ICPA is an organization that is so important for research, education, and training of perinatal chiropractic, prenatal, pediatric, family wellness style practice. And we're doing the ICPA Gathering, which is a meeting for all ICPA members who are welcome to come and join. And we're going to really have an opportunity to connect, to learn, to inspire one another, to share our passion, and help people recognize that the ICPA is their home. Whether they practice one technique or another, or they practice with one style of practice or another, if you believe that pregnant and pediatric populations deserve access to chiropractic care, then the ICPA is your home. Or one of your homes. And so it's going to be a really exciting meeting. It's August 19th and 20th. Check it out, icpaforkids.com. Excellent.
I'm so glad you're doing that. And as you said that about, how you described the ICPA and who this is for, I want to share something that Mile High accomplished a few years back with the Colorado Chiropractic Association. Now, please understand, Mile High is separate from the Colorado Chiropractic Association, but we do our best to influence chiropractic globally, as well as in our own backyard, meaning our own state and organization and state board. But this is a position statement that we got passed for the Colorado Chiropractic Association annual meeting. You're going to love this. It was this, I'll just read it. Whereas addressing subluxations and spinal adjustments are central to the Colorado Chiropractic Practice Act, the Colorado Chiropractic Association considers it standard practice and an acceptable standard of care for practitioners to choose to deliver care solely for the location, analysis, and correction of spinal subluxation in child and adult patients, regardless of whether symptoms are present. Subluxations are in and of themselves a detriment to one's health. That was
Beautiful. I mean, I think that's what's so important about this. And gosh, man, you just nailed it, is that this is not about a natural pediatric, natural pediatrician. This isn't about treating ear infections or colic or turning breech babies. This is about chiropractic for the sake of reducing subluxation, facilitating the enhanced expression or the full expression of innate intelligence so that the body can not only survive, but thrive on a whole nother level, and not doing it because somebody is sick or unwell, but just because they deserve to live a life free of subluxation. And beautiful statement. I think I'm so proud to have donated to the Colorado Chiropractic Association, the work that you guys are doing out there. I think it's wonderful.
And see, here's the thing. As many people know, you can have state organizations or state boards that won't necessarily back up kids getting care in the absence of symptoms just because it's a good idea for their health to have their spine assessed for subluxation, and practitioners then assessing a person and delivering an intervention that's non-invasive, but just because the child will be better off without subluxation. And it's vital that that be an awareness in a state board level and a state association level. And unfortunately, it's not more frequently in many places. So I was very glad we did that. I know that's exactly the kind of thinking that, I knew Jeannie very well, that we had, have in terms of the ICPA. So, and that's why we did that. So this is going to be an incredible event for the ICPA. Mile High, what was your experience of being Mile High the last couple of years?
I'm not a typical chiropractor who enjoys going to most chiropractic events, to be perfectly honest. And I remember coming out to Mile High the first year, and I was just blown away. It didn't feel overly philosophical to a point where people who liked learning about the science of subluxation and kind of more tangible ideas, that they couldn't get a part of it. And it wasn't so grounded in the science that people couldn't be inspired and excited about chiropractic. It was just this beautiful blend of the philosophy, science, and art of chiropractic. And it didn't matter, just like I said, it doesn't matter what technique you practice or how you practice. The ICPA is there for you if you're into family wellness. It felt like the Mile High community was just, hey, if you love chiropractic, if you love the principles, if you believe in correcting subluxations through the adjustment, this is the place for you. And, it just, I think the best way to describe it is it felt like, this is what chiropractic is. These are the people who are doing it. These are the people who are supportive of one another and excited. And it was just such an incredible experience. I loved not only the presentations, but the energy that you created, even in the vendor hall, and the connections that people were able to make with friends and colleagues and all of that. That was just wonderful. And it's kind of, to be perfectly honest, it was kind of one of the motivating factors that made me say, let's do something like this specifically for pediatric and prenatal chiropractors, because I was just so impressed with what you were able to create with Mile High.
Well, and I'm grateful that you picked that up from being there. And, people have told me over and over again, I thought it is important, the quality of speakers that you have on any stage, most certainly. And I put all my energy into that. And I hear over and over again from people what they love. They love the speakers. And I'm sure this is going to be the case at the ICPA event that you're doing. They love the speakers, but they even more love the camaraderie, the community, as we talk, as Jack Borla says, the talks in the hallway. They like that because they feel like their heart and soul is connected. People have the same vision, and I know that's what people are going to experience at the ICPA event. So that's because I know the values that you have as an organization, and that's going to come through. So now that helps people communicate or move towards a family wellness practice. Now, I think you'd probably agree, and if not, let me know. People might be attracted to ICPA, and they may think, well, I can't go there. I don't really have a pediatric practice, but I'd like to, or I'd like to grow that part of my practice. They're at least facing that direction, and they want to have more family wellness practice, but they don't know how to get there. So they should feel welcome at the ICPA, even if that's not their current focus. So, and that's what I think you would want as well. That they're moving towards that. What are some things that people can do in their communication to help them move more even towards have a family wellness oriented practice?
I think what's so important to understand is that communication is part of the art of chiropractic. Whenever I talk about the art of chiropractic, I talk about technique, I talk about, business skills, but I also really talk about communication because as anybody who's been in practice will know, helping people get well and stay well, right, through the adjustment of subluxations is the easy part of chiropractic. You follow the principle, you correct subluxations, you give people time, you keep them in an unsubluxated state, and their body is going to get better. It's just, as Sid did with dropping the keys. But getting somebody to give you an opportunity to adjust their child, that's the hard part. Creating that trust, that connection where somebody's going to come in their pregnancy after having a couple losses and say, yes, please adjust me and help me get ready for birth. Having somebody bring their 3-year-old child who's been to every doctor under the sun without any answers and say, please, can you do anything? That's the hard part. And we need to get better at communicating what we do, because too often we try to communicate chiropractic through the prism of allopathic or pathogenic type of care. We talk about symptoms as the reason or what we're going to do to help your child or your pregnancy in terms of your symptoms. And you have to learn how to communicate chiropractic for the sake of chiropractic, right? For the sake of locating, analyzing, and correcting vertebral subluxation. But most chiropractors, I think, struggle to do that because they don't have that philosophical foundation first, right? The philosophy helps ground you so that your communication becomes much more effective in talking about the locations and correction of subluxation. Otherwise, we try to talk about chiropractic through like treatment of disease, and that just doesn't work. It doesn't create the practice that we want to try to create. So the first thing I always tell people is start with the philosophy. Ground yourself in the philosophy. Understand why we're doing what we're doing, because only then can your communication properly convey that to the person in front of you. And now the conversation becomes, your child is experiencing this world through a compromised, subluxated manner. If we deliver a gentle adjustment to restore normal neurological tone, your child will have a greater capacity to adapt to stress. They'll be able to better adapt and interact with the world, and they're going to be more vibrant, they're going to be healthier, they're going to be happier. That's why we're going to get them adjusted now, and that's why we're going to keep them adjusted through the rest of their life. So
important. And that's the delineation. Is so often people think, sadly, chiropractic in a box of, well, we do this adjustment to treat this versus, well, just the gift of living a life at your full potential, because it's not inhibited or obstructed from subluxation, so best expression of innate. And starting that with a kid, with parents and with children, as compared to saying, oh yeah, bring them to the chiropractor when you have ear infections, which is not the message as a profession I'd like to see put out, but unfortunately it's put out way too frequently.
Yeah. It's a major problem. We're still so many chiropractors, even chiropractors who are really passionate about chiropractic and subluxation correction, have been indoctrinated from birth throughout their life and continue every single day, indoctrinated in this mindset that you wait until the bathtub is overflowing before you unplug it. We're so focused on disease treatment or symptom relief that even if we want to talk about subluxation for the purpose, or chiropractic for the purpose of subluxation correction, we tend to still do so through the symptoms or disease. And we need to break ourselves of that. And we can't do it unless we really define what it is that we do that makes us unique and necessary to the world. I'm a big advocate when I talk to students or when I talk to docs. I always explain, like, what is the one thing that you as a chiropractor do that nobody else in the world does?
Right. Exactly.
Analysis and correction of vertebral subluxation. That doesn't mean that other things that you do in your office aren't valuable. But why would we put all of these other services at the forefront of our profession when those are all performed by other people and often performed better by other professions?
Right.
So what's the one thing that we do? Well, we correct subluxation. And guess what? Not only is it almost universally needed, but it's incredibly valuable when we apply it, and people are seeking what we offer. They just don't know that that's what we do.
Right. Exactly. And the more we say, oh, no, this is a different way to treat conditions, the more we lose our identity and people are actually less attracted. It sounds weird, yeah. And so I'm so glad the ICPA is doing their best to help switch that communication in chiropractors and the chiropractic profession. So, it's just such a vital thing. So, and it comes back to the importance of philosophy, right? That philosophy is important to have an understanding of what your objective and communicating that to the person that's, discussing their kid's history with you or that you're tableside with. So, how did philosophy become important to you?
Like I said, I didn't really grow up with philosophy. But what happened was I was sitting in first quarter at Life University, and I was going through all of like the medical terminology, anatomy, all the basic stuff. And I felt like I was losing sight of why I was there. And so a friend of mine said to me, well, why don't you come to Pierce Results Club? And David Koch was the faculty advisor. And David Koch, who's the philosophy instructor, happened to start every club meeting by reading from a green book. Now, this was week 5 of first quarter. I had never read a green book. I'd never seen one. And he flipped from The Bigness of the Fellow Within, chapter 11. It's called This Inner Power Speaks.
Right.
And if you'll allow me a moment, it's been so ingrained in my head from that moment. It says, we chiropractors work with the subtle substance of the soul. We release the prisoned impulse, the tiny rivulet of force that emanates from the mind and flows over the nerves to the cells and stirs them into life. We deal with the magical power that transforms common food into living, loving, thinking clay, that robes the earth with beauty and hues and scents the flowers with the glory of the air. In the dim, dark, distant long ago, when the sun first bowed to the morning star, this power spoke and there was life. It quickened the slime of the sea and the dust of the earth and drove the cell to union with its fellows, producing countless living forms. Through eons of time, it finned the fish and winged the birds and fanged the beasts. Endlessly it worked, evolving its form until it produced the crowning glory of them all. Through tireless effort, it blows the bubble into each individual life, and then silently, relentlessly, dissolves the form, absorbing the spirit into itself again. And yet you ask, can chiropractic cure appendicitis or the flu? Have you more faith in a knife or a spoonful of medicine than the innate power that animates the internal living world?
I got to tell you something. I got chills. And here's why. You're never going to believe this. That passage, when I was growing up, and I'm a second generation chiropractor too, my mom went to chiropractic school when I was in high school. So she was going.
Oh, wow.
Yeah. So there's this transition. She did prereqs when I was in junior high. And that passage was up in a framed, in a frame in my bathroom when I was a teenager in high school.
I love it.
And I read it every day. And I wasn't thinking of going to chiropractic school at that point. But a few years back, I found it in the damaged frame in a garage, the glass broken and all that. And I reframed it and put it up in my office. So you gave me charge. Yeah.
For me, when I first heard that, all of a sudden my perception of what chiropractic was transformed.
Right.
Because for growing up, I got adjusted. That's what I do. You're a child of a chiropractor. But I thought of it so much in terms of alignment and pain and function and this, that it never crossed my mind that what we're really doing is allowing people to tap into that intelligence that helps one half cell from a man and one half cell from a woman come together to create one single human cell. And then that cell divides and divides and differentiates, forming all the parts of our body to create a new human being. That all of that happens without having to go to school, without having to have a doctor, oversee any of it, all because of that innate intelligence. And in that moment, I realized, oh my gosh, when we get to apply an adjustment, we're helping people have that intelligence be fully expressed through them.
Right.
And that's it. That is so much bigger, right? In terms of the purpose for a profession, that is so much bigger than helping people have better quality of life or helping people function better. Those things aren't bad, but it's kind of like buying a Ferrari and only driving it through a school zone. That's not what the potential is.
And that's funny. I tell people that so often. Well, but nothing's wrong with me. Well, I was like, well, yeah, you're in second gear and you have 3 more gears and you haven't even tapped them yet.
Yeah. An analogy, and this is an analogy that I love that honestly, I'm not going to be able to use very long because, we're getting old and we can't use it. But I say to people, do you remember when high definition TV first came out?
Right.
And now I'm getting patients who say, no, I grew up with high definition TV. But for people who don't, they have that moment where they were walking around Best Buy or Walmart and they saw high definition TV and they were just stunned that, oh my gosh, this is what it could be.
Right.
And no matter what they did, when they went home to their standard television, even if it was top of the line, it was never as clear or as good as that first time they saw high definition. And when people are well adjusted, when their nervous system is able to fully perceive and respond and coordinate and adapt, when the innate intelligence is able to be fully expressed through every cell of that body, it's living life in high definition for the first time.
Right. Exactly.
And it's not that the other stuff is bad. The other TVs aren't bad. Mm-hmm. But once you see high definition, once you live in high definition, why would you ever want to go back?
Right. Exactly. It's so funny. It's so funny. My son always I just tend to go to the regular channel and he's like, what are you doing? Go to the HD one,
That's okay. My kids freak out when there's a commercial because they're so used to streaming platforms. They have no idea what a commercial is.
Yes, I know. That's so funny. So, this is one of the things about the ICPA is that it's supporting the next generation of chiropractors. And I personally, it keeps me up at night. I get very concerned about the next generation of chiropractors and the future of chiropractic. I put the energy into Mile High and this podcast, the Mile High annual event, other things because of that, because I consider humanity without really clear chiropractic expression as to what the gift of chiropractic and that being incredible loss. I know you put your energy into educating and the energy of the ICPA, not because you just don't have a lot to do and need a new hobby, but because you care about that as well. So what are some things that are important in supporting the next generation of chiropractors?
Part of the problem is that the chiropractors that are often teaching the next generation of chiropractors, it's not that they're not bad, right? Like when I think of like my friends, my colleagues, people who, even my instructors at Life, I thought they were phenomenal, but they're restricted by the guidelines that are placed on it by the tyrannical CCE and the national boards and all of these other things that they have to pass. Mm-hmm. So the problem is the education system that our new graduates or new docs are going through is not designed to help them become chiropractors. It's designed to help them pass national boards and get licensed.
Right.
And that's an important distinction, because I look back at my experience at Life, and everything that I needed to become the chiropractor I am today was available if you were willing to go and do it. Show up early to labs, stay late, go to clubs, do all those things. The problem is that most students are so overwhelmed with just getting through school. Mm-hmm. And, God forbid they're at a school that doesn't teach any philosophy or only teaches subluxation as a historical construct. They don't understand, they never get an opportunity to really see the possibilities of what chiropractic is. And I'll give you a great example. I've been saying in some of my talks that philosophy creates possibility. There's a school nearby me, Kaiser University, that just opened up a chiropractic school.
Oh my God.
And, very early on, I offered to reach out. I reached out and I said, I'd love to teach a philosophy class. I'd love to teach prenatal or pediatric adjusting. And they asked for my CV. And at the top of my CV, it says, that I'm passionate about subluxation correction as a routine aspect of prenatal and pediatric care.
Right.
And I almost immediately get a message back saying, well, we're not really interested in your version of chiropractic. We're an evidence-based
your version. Oh.
And so what's interesting about it is the students there, innately they recognize that there's something missing. Because I've had a bunch of students reach out to me over the years that want to learn what it is that we do. And most of them are they're blown when they really see what we're doing. But I had this one student reach out to me one day, and she says, I love what you're doing in practice. I'd love to come learn how chiropractic can help pregnant patients with their back pain.
Oh.
And it was that with back pain that I thought was so indicative or so emblematic of the crisis that we have in schools today. Because without philosophy, she had no idea of the possibility of what chiropractic had to offer the world.
Right.
Her perspective, her philosophical foundation, her blinders were that chiropractic is about uncomplicated musculoskeletal pain.
Right.
Now,
which is a glorified physical therapist. It's just a glorified physical therapist.
And it could absolutely help people in that situation. But again, Ferrari in a school zone.
Right.
So making sure that students have access to this philosophy is absolutely vital, because even if they're not super excited about it, you need to give them something to open up their mind just a little bit. Right. Because now they open up their mind and all of a sudden they'll see, they'll hear from a practice from a colleague, oh yeah, I adjusted this person and all of a sudden they were able to get pregnant after having infertility. They hear that, and now with that little bit of exposure to philosophy, they have a better context for why that happens, why that makes sense.
Right.
So I would urge everybody, if you are a chiropractor who understands the principle, who's passionate about what we do, there are schools near you or schools around the world that would love to hear from you. Students at if you're an ICPA doc, reach out to the ICPA clubs on campus. If you're not associated with any technique, just reach out to a student and try to, offer a talk or offer an opportunity to come in and do some work in person. They're craving it, right? They're craving to know what we know. most of the time they just don't get an opportunity to do it. I'm so passionate about connecting with students and helping them to see the possibilities of chiropractic, and honestly also see the success that's possible through this style of practice. Because I think a lot of chiropractors love the idea of subluxation, correction, family wellness practice, but they may not actually see it in person. And as a result, they end up getting out into practice and they feel the need to add in all sorts of other things to kind of pay the bills.
Right.
So, whether you're helping students come and shadow, or you're going on campus, or you're doing virtual stuff like this, reach out to these schools and reach out to these students and help them understand what chiropractic really has to offer. And I think it's just absolutely vital if we really want chiropractic to exist beyond our generation.
Yeah. And again, I know you do not have to put out the energy that you do, and I'm grateful you do. And so many other people are, and I know you don't need me to praise you for it, but I know I'm praising you because I know you do it because it's a sense of purpose, that what you just said, it's vital that we shift with the direction of chiropractic. And I'll tell you, to me, honestly, I feel like we have a new renaissance in chiropractic blossoming, because I feel that people are aware, even though the educational institutions don't and the political organizations don't, people that are chiropractors know that the allopathy in chiropractic, or allopathetic, is a dying model, and that they're reaching for straws. And that's what's going to help chiropractic thrive, and the chiropractors thrive, is that they're actually showing the differentiation by actually delivering chiropractic, which is.
I think what you're honestly seeing is the first generation of chiropractors that are really starting to blossom outside of the insurance dependency model since the 70s, right?
Right.
For decades, chiropractic was about the location analysis and correction of vertebral subluxation. And all of a sudden, insurance reimbursement came in. Right. And now it became, let's take this chiropractic thing and apply it to these specific diagnosis codes. And that way we can get reimbursed. And when all of a sudden the reimbursement started to decrease, well, let's add other services so we can continue to bill and collect. And then what's happened is, I think to the betterment of chiropractic overall, is insurance started becoming less and less willing to cover chiropractic. And as a result, people started to have to revert back to understanding and communicating chiropractic from its most pure, basic foundational premise. And what you're seeing is this new generation of chiropractors that are coming in, who are so fired up about chiropractic, family wellness, subluxation. I see it every day. All of these family wellness ICPA doctors who are reaching out, begging for an associate. They need help, because you're seeing more people graduate and free themselves from the shackles of insurance dependency and be able to just deliver chiropractic. And there's a need and the demand for it. And what you're seeing is these practices are thriving and growing, and there are not enough students to support the demand for associate doctors within this paradigm. And I think that's honestly, as much as I've been kind of pessimistic about the future of chiropractic, I'm starting to change that based on what I'm seeing in practices who are just growing in this family wellness, direct pay type of model. I think it's just wonderful, and hopefully that's the future of chiropractic.
I think it's a new spark. It's just that the thing is that people have to learn chiropractic philosophy, science, and art somewhere, and they're not learning it in school as to the level that we would like to do. That's not a new thing. My dad told me that it was on the decline when he was in school. He thought it was great education. He started, going downhill at that point because they were taking chiropractic stuff out of the education. You're talking in the late 70s. So this is not a new thing. I'll tell you, to echo what you just said, in Colorado, and my numbers are not going to be factual. They're going to be roundabouts. I don't recall, but roughly somewhere 12-ish years ago, maybe 15-ish, about that range, Colorado lost, I was very happy about it, lost the amount of benefit people would have for auto accident. The auto accident that got pulled, the PIP, whatever dollar amount dropped. And there was something like 1,000 chiropractors that closed their offices that year and left Colorado because they were not going to, because their income was dependent on auto accidents. And you know what happened to my office? It shot up because one, all these chiropractors left, and I didn't even know there was auto insurance benefits because I didn't do it. I was like, oh wow, I didn't even know that went away because I wasn't aware of it. So
that's okay. That 1,000 chiropractors probably came to Florida.
They probably did. They probably did. But this is what's going to happen is as that goes away, people realize I have to do something. I have to actually communicate and bring value to chiropractic, or sadly, they're going to keep adding other things that are not chiropractic. But that's also, you're going to compete with every other thing in the marketplace in healthcare because everybody else can sell supplements. So like what, and not that the supplements are bad. There's a whole bunch of supplements I take, but there's lots of resources. How are you going to differentiate that? Why don't you put the time and energy to what you do that no one else can do?
Listen, I take supplements. I get massages. I see an acupuncturist. I've worked with, I've gotten physical therapy in the past. I've done all of these things. They're wonderful things to do. But what is the one thing that you can do that nobody else on the planet can do? And it's
exactly
analyze and correct subluxation. And if that is not at the forefront of everything that we do and communicate as a profession, I don't know,
Exactly. So, thank you for sharing so much today. People are going to love this podcast. We were so grateful you presented at Mile High. The breakout session, people raved about it. I'm so glad we started doing those breakout sessions and added that to Mile High for more depth for people that wanted more. And then also your presentation the year prior. And I know the ICPA event is going to be phenomenal, especially with the energy that you're putting into it. To remind people the date, the URL, how people can dial in to be at that.
Yeah, August 19th and 20th. It's going to be in Reston, Virginia, just outside of DC. It's going to be at the same hotel that we hosted the Freedom to Family Wellness Summit 4 years ago. It is, you can check it out at ICPA4kids.com. That's ICPA, the number 4kids.com. Even if you can't make the event, if you believe that pregnant and pediatric populations deserve access to chiropractic, that they deserve chiropractic for the sake of subluxation correction only, because we know it helps them better adapt to and respond to the world around them. The ICPA is an organization that you should be a part of. Between the research that they perform, the education they do for the public, as well as the training they deliver to chiropractors, there's no pediatric or family wellness organization or association that's anywhere close to what the ICPA is doing. And if you're not a part of it, it's time to join, so that we can all come together and say, this is who we are as a profession, this is what we stand for, and this is what we want to do going forward. So Danny, I can't begin to thank you enough. I can't wait to be back at Mile High next September, and I can't wait until we get to hang out again.
Well, again, I'm grateful for all you do and the ICPA and everybody involved with this. This event's going to be phenomenal. I'm so excited for the ICPA, and I'm grateful to be a member and supporter of it. And I highly recommend, if you're listening to this podcast, again, chiropractic care for children, just because in and of themselves, subluxations are a detriment to their development, to their potential, then you want to support the ICPA, and making sure that the location analysis adjustment of subluxation is something that is available, accessible to children, and they don't need to have a symptom to do that. I know that's something that the ICPA has as a center of value for them.
Absolutely.
So again, thank you so much for all that you do. And again, if you're listening to this podcast, make sure you hit subscribe. So you're always dialed into Mile High Tick, and save your seats. If you want to get dialed into Mile High 2023, you can find out all the details at riseup2milehigh.com. And again, thank you to everybody at the ICPA, and thank you to you, Dr. Ian.
Thank you.
And keep changing spines and lives and minds with chiropractic.